During a pandemic for the first time, many are concerned about the COVID-19 vaccine. Right now, the vaccine is only approved for kids 12 or older under the emergency use authorization.
But there's a different vaccine that some may be forgetting about, and of course that's the flu shot. Joining us live now from OHSU is Dr. Eliza Bakken, Associate Professor of Pediatrics. Good morning to you, Doctor.
Good morning.
Good morning. So we are getting into that flu season that we typically see during this time of the year. During COVID, should we still be as concerned as we are usually about the flu?
Absolutely. Just like COVID, the flu can cause serious illness in children. Children can be hospitalized or even die of the flu. So usually flu season in Oregon starts sometime later in the winter. We think this year might be a little bit more unpredictable. Luckily, many of the steps that we are already taking with COVID to decrease the spread should help with the flu as well, like masking, distancing, and hand washing.
Yeah, it's interesting. Last year we thought that there might be this potentially, twin-demic of the flu and COVID playing out at the same time, but we really didn't find that to be the case for last year's flu season. So I'm curious, how do you think us spending a year at home, and especially with kiddos staying home and out of the classroom, how has that affected some of the back-to-school illnesses that we tend to see?
Yes, so usually the illnesses that we see the first time a child gets a virus seem to be a little bit more severe. And so if children, especially younger children, is really where we would see it likely, hadn't been exposed to things as they would have usually with that preschool or kindergarten experience, we may see some more significant illnesses, especially in those younger children. But overall, I think we're expecting that the biggest difficulty will just be having, as you were saying, multiple illnesses circulating at the same time.
Yeah, and how could the flu, complicate the COVID pandemic for kids and adults when it comes to just that? Also, like hospital space, I mean, really everything that comes with that.
Yes, I think that's what we're really concerned about. We really want to make sure that families take all the steps to protect themselves and their children this year. And that includes those really important flu vaccines and all the steps we're taking with masking and distancing. The reason is to really work as hard as we can to prevent those more serious cases. As you were saying, our medical resources in the area are really stretched thin right now. And so we want to keep our kids healthy and out of the hospital.
Yeah, so the flu, COVID, even some colds, especially initially can share some of those similar symptoms. So real quick, let's run through some of the symptoms that we might be experiencing this cold and flu season, and when does it become a point where you do need to go out and seek that medical care?
So most of what we would say is that any illness, and that includes any of the minor symptoms we might think of with a cold, so cough and congestion, sore throat, runny nose, all those things are potentially symptoms of any of the illnesses that we're seeing circulate right now, including flu and COVID. We often think with flu and often even with COVID that especially children are more likely to have higher fevers with those illnesses than maybe some other run-of-the-mill kinds of viruses. We really encourage everybody to get tested for any of those symptoms. And certainly the warning signs are really the same this year with COVID circulating as they are in most flu seasons. If you think your child isn't acting normally, if you think your child isn't eating and drinking well, is having trouble breathing, then you should be reaching out for care. Oftentimes your child's primary care provider is a great first step as you're trying to sort all that out and figure out what options are for things like testing. And so, if you're worried about your child or yourself, reaching out to that primary care provider is a good step.
Yeah, and of course, getting vaccinated right now can really help lift that burden of worry for a lot of families this year. Dr. Eliza Bakken from OHSU, thanks for joining us this morning. Good to talk with you.